Okay, so we're gonna do start.
See how much quicker this one inflates?
Mm-hmm.
Those thigh cuffs are just big and they're hard to get snug. If they're nice and snug, they usually inflate about this quick, but...
Yeah, those ones were a little difficult to wrap around.
Yeah, they are. So that's why I said I think, honestly, the hardest part of this test is just getting to the point where you get the thigh cuffs snug every time. So we just want to wait for these to level out. Okay, these are looking pretty good. You click stop. So you can see here, they don't have to be perfect. We just want them close. And if we scroll back one segment, these ones actually look a little bit better.
Yeah.
But you see how the red lines kind of capture the average? Like one of these is a little short, some of these are a little tall. But this actually looks pretty good. And the amplitude is around 19. You've got a nice strong diacritic notch. So this looks more representative of what you'd expect on a healthy patient with it against their skin.
Okay.
If it wasn't over pants, the amplitudes would probably be even higher than they are.
Okay.
Okay, so these ones look the best. So we'll click next segment. We'll bump it over to the left calf.
Like listening, but then I'm like, wait a second. Okay. Do you want me to do this one too?
Yep, I'll let you do this one completely as well as select them.
All right, here we go.
So these are also sensitive to patients' movement. So if you have them like if they are like flexing their calves or fidgeting or things, it can affect the reading. So try to encourage them to lay as still as possible and relax.
All right, that looks pretty consistent, about right there.
Yep, that looks great. Okay, so there is one other thing I want to mention right here. Sometimes with patients that have good flow, you'll get them going off the chart. Like you won't even be able to see the tops, it'll bunch up. If that happens, that's what this little gain thing down here is for. So the gain, the default is 1, but you can turn it down to shrink them.
Okay.
Or you can turn it up. You almost never, so if it was like this, you see how it's like black on the top?
Yeah.
Like thick, that means it's going off the charts. So if you saw something like that, you want to just go down 1 increment. These look fine, but what we want to remember is if you do it on the left calf, you have to do it on the right calf.
Okay, to change.
You don't have to change it for all of them. You just want to make sure that the segments on both sides have an equal gain, because otherwise it confuses the providers. They don't look at it close enough to realize that that's what's happening. Okay, and that looks good. So you click next segment.
What are we doing?
And now we're Pvr right ankle.
Okay. All right, so start. So about right here.
Yeah, they're
kind of different. Some of them are kind of different.
Yeah.
But
so typically we want them as consistent as possible. If it were me, I would have let it run just a couple more seconds to see if we could get that. But I'll always scroll back and check. So these ones, we have the same problem. Some are pretty short, some are kind of taller. It kind of bounces around. That makes it harder to measure the amplitude. But this looks pretty good. That's acceptable. But I generally try to let it run just a little longer so we can get it a little better. But
yeah, like the one that's in the middle, like just a little bit left, yeah, that's like the only one that kind of like is thrown off a little bit.
Yeah, so it's a little low on the ends, higher in the middle, and yeah, so but that's okay. It's still fairly representative.
Okay.
The next segment. Now we're going to do the PVR on the left ankle.
Okay. this will be pretty fast when you get the hang of it.
Yeah. Typically, when you feel comfortable doing these, I wouldn't expect it to take more than about 20 minutes for the whole process.
Okay. Oh. So I saw consistency like at the beginning, and then it looked like that one that's almost towards like the end kind of jumped up.
Yeah, let's actually scroll back one increment.
Okay. Oh, accidentally double clicked, I think.
No worries. So we have the same problem here with both of these, so I'm going to click forward one more as well. How we have some that are really short and then some that are taller. Mm-hmm. I feel like this doesn't quite match the actual average of them. This one is maybe a little bit better, but here I'd probably take this peak and this trough, because that way we have some that are a little shorter, some that are just a little bit above, and that amplitude is more representative. Okay. But that's why the more consistent they are, the easier it is for us. So if you can't get it, you can't get it, and this is okay. But typically I just let it run, just, I don't know, it will time out after 30 seconds or so, but let it run a couple more seconds until it just evens out. Encourage them to relax.
Okay.
And then we can click next segment. Okay, and now you see how the graph has changed. We're back to doing a blood pressure segment. It says BP left ankle. Mm-hmm. So we want the PPG probe again to go on the big toe of that left foot. And again, just verify that the sensor side is going against the pad side of the toe. If you guys don't like that white clip, so the white clip, some people love it, some people hate it. You can actually remove the sensor from it, use just medical tape to tape it on the segments you're using. That's entirely up to you if that's easier, or if you have patients that it just doesn't fit their toes very well.
What about, like, because we, obviously being in podiatry, we deal with a lot of wounds that are on the big toes. What is your recommendation so we don't end up physically putting this device on a toe that has a wound?
Yeah, if you have any wounds or anything, move it to another toe. If you don't have any toes that have wounds, try to put it, I'm actually trying to remember, there is a specific spot we want to place it, and we actually put it on the top of the foot. I'll find that out.
Oh, like taking it, the actual clip off and then taping it to the foot.
Yeah. Okay. So you can put it anywhere. The hard thing is if you move it off of the digits lower on the foot, people usually have pretty thick calluses, and it's hard to read the blood flow there. Mm-hmm. So if they have toe wounds, you can actually tape it over a vein or artery that runs across the top of the foot as well.
There's one up here.
But typically, if their big toe has a problem, but some of their other toes don't, you can tape it onto those toes as well.
Okay.
We just need something some spot where we can measure blood perfusion downstream from the blood pressure cuff.
Okay.
Okay, so do you have the clip on the left toe?
Mm-hmm.
Okay, and I'll let you run these ones.
Okay, so start.
So one thing that happens more often with the feet, you can see how small these bumps are. Mm-hmm. Feet generally don't have quite as good a blood flow as people's hands. And if you have cold feet on top of that, it's going to get even worse. So if you're having a lot of difficulty actually seeing the return of flow on patients' toes, or when we're testing the ankles, it's best to try to warm up their feet a little bit. If they... Okay, so you see these, they're very subtle, but they are consistent waves. We click capture pressure and stop. And then we'll scroll back until you see the relative flat line.
Right. Like
so
right
yeah,
there.
about there is where it starts.
Now, do you want to do it like about the middle of that bump, or do you want us to like do it like right here, the beginning of the bump?
It won't. Here, let's actually click on that where you have your mouse. See, when you click on the front, it does change it by a few points, but not much.
Okay.
Typically, I put it at the peak or the crest of the first wave.
Okay.
If you put it right before, it's not going to modify that much. There's only 2 points.
Okay.
but either one is okay. I typically say peak.
Okay.
Okay, but you see how these are really faint? If you're seeing it where you just cannot tell, I would try to warm the patient's feet up. If your office is fairly cold, while you're testing people, if you have blankets or towels, something you can put over to keep them a little warmer while you're running the other segments, that can be helpful. But some people, you're not going to have any problems. Others, it is going to be difficult to test the feet.
Yeah, she said her feet are a little cold.
Yeah. Okay, and then we'll do next segment.
Which is going to be the right ankle.
And then BP right ankle. Has your provider told you whether or not they want toe segments done?
What did he say? He says he usually with our ABI that we're using, we would do the toe, the ankle, and the arms.
Okay.
Is what we would normally do.
Okay.
So yeah, yes to the toes. Not so much of the calf or the thigh, unless he wants to do the segmental test.
Yeah. And you can actually, when we're scheduling the patient for the test, the area where it had all the blue checks, you can decide exactly which ones you want selected. So if you want to unselect some and select others, that's fine. I can show you how you can also do it just from the testing software.
Okay.
But we'll finish this. This will be the last segment that's scheduled, and I can show you how to do the toes from here.
Okay, so start.
Yep, we're getting those consistent waves back.
Oh, okay, stop. All right, so we're gonna go back. So hers is like right here, right?
Yep, that's where I'd put it as well. Yeah.
Okay.
That looks good.
All right, so
the next segment. Okay, so it takes you back to this screen. So we have done all of the scheduled segments. You'll see these green check marks here.
Yep.
If the toes were not scheduled when you were setting this up, we can actually go in and do the toes. So you can do blood pressure on the toes, you can do PVRs on the toes, you can do any of those. For the sake of the training and the length we have, because I know you were a little short on time, we'll skip those for now, but you should have 2 little toe cuffs as well, correct?
Yeah, I saw them somewhere. They're not on the cart though.
Okay.
Yeah.
I would make sure you keep them with the cart. They are easy to lose.
Yes.
And it's crazy. They're actually more expensive than the big cuffs. They're about $130 a piece, which is nuts. Yeah. So don't lose those.
Tube of plastic.
Yeah. So you can basically, like, if we want to do a blood pressure on the right toe, you just select this.
Okay.
And then you can run it just like you would otherwise. So I'm just going to exit out of that. This is one of the most important parts of the entire thing, because if you do not do this before you turn the device off, the test is lost and gone forever. So always, 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 once you're done with your scheduled segments and any additional segments you might run, like on the toes, click Next, and it will show you a preliminary report. The preliminary report, if you want to look at it, great. If you don't care, don't worry about it. If something funny happened during the test that you want your provider to know why something looks strange, like let's say you couldn't get a good PVR on the right ankle, you can put a note in here, and then always, always click Save.
Okay.
So when we click Save, it saves that test. If this is disconnected from the internet, it will still save it here. So you see, if you complete a test, there's one right there. Sometimes it takes a couple of seconds for it to sync over. We'll refresh this real quick. Let me just check, verify that this is still connected well, which it is. Okay, so you see how that's 0 now? The sync operation takes a couple of seconds. So that test we just did was sent back to our scheduling website. Now when we go to our testing tab, you'll see that the one we scheduled just did is gone. Now it's going to be under unsubmitted. So under unsubmitted, this is your last chance to go in and verify that everything's correct and that you are going to submit it to your doctor. You just click on this blue link. You can actually view the report if you want to. It looks like, okay, I know why that happened. We'll probably don't have one assigned. So you see here, it says no read sites for this test site assigned. So we have to set your doctor up with a read site.
Yeah.
Once that's assigned, you can view the reports, and then you want to select your doctor out of this drop-down menu. If you only have one, it will be the default, and then click approve and submit.
Okay.
When you click approve and submit, it will stamp your name, date, and time on it and send it off to them to do the interpretation.
Okay.
Once the interpretation is finished, we'll go back to tests. It will show up here under interpreted, and you can go and print the final reports and scan them into your EMR, do whatever you need to with them. Do you have any questions?
Nope.
Okay. With the unsubmitted tests, you don't have to submit them right after you finish your exam. They'll sit there until you're ready to do it. Some people like to do it right after. Others will wait till the end of the day and submit 3 or 4 of them at a time, however many you've done. So that's entirely up to you.
Okay.
You just click on that link, select your doctor. If there's only one, that's default, and then click approve and submit.
Okay.
It sounds like your provider has not been set up yet with one of these. So we need to get the user authorization form we talked about so we can set them up with their own credentials and assign them to a read site so that it will be sent directly to them. They can log in from any computer, do the interpretation online. If they've never done this before with the PadNet software, we can set them up to do like a 20-minute training with our read site expert to navigate the site and learn how to do that and all that. So, okay, do you have any other questions?
I think that's it.
Okay, if you need anything, please let us know.